Ladies and gentlemen, tonight we are discussing HIV in New York, past successes, current challenges, and future goals.
We have the experts and the professionals right here to give you firsthand info.
True story. So welcome to the show, everyone.
Thank you.
Thank you.
And, I think considering all of the stuff that took place and it's still going on with the current crisis that we have with Ebola, we definitely have challenges on that front, but what I'm hoping will happen, and I guess we'll be the ones to sort of to bring this to light, is to bring attention to these infectious diseases and how we can get a hold of them. If this was the case, let's say 33 years ago when we first had the onset of the HIV/AIDS epidemic, you see how this was stifled here, at least for now, in terms of Ebola. But now getting a hold of this disease, which is we still have millions of people infected. We still have a number of people being infected. The infection rates are not decreasing necessarily. And if we had taken some of the steps we took with the Ebola crisis, we might not be in this position today. So
that's an interesting comment. We could talk more on that one.
But I think there were a lot of lessons learned from things that took place in the past.
Of course.
But let's see how we can take these lessons and move on into the future, especially here in New York City.
Right.
So what's the current state of HIV/AIDS in New York City and in Harlem in particular?
So thank you so much for having us. The current state is we're in a good state. We have really battled this infection. The first cases were identified in 1981. It was a very scary time. No one knew what was causing these infections. And there were many people dying of something we didn't understand what caused it. We were able to identify the virus 3 years later and knew this was a virus that was causing this. Identified that this was spread by blood and body fluids through transfusions, through sexual contact, and from mother to child. And through advocacy, a lot of public health messaging, through science and a lot of work on that end, we were able to identify what causes this. Medications were developed, and in the face of a lot of people dying, medications were introduced, and the infection was brought under control because of really wonderful medications potent medications that became available in 1996.
So a question for you, and I don't know if you know the statistics that well, but I would go back to my Bible. Excuse me. Harlem Hospital
Bible statistics?
Well, Harlem Hospital Center's 2013 Community Needs Assessment, and I believe that they're in the process of trying to get new data. But, as far as Central Harlem, the Harlem community, a lot of comorbidities, but HIV and AIDS, as far as out of all 5 boroughs, this community in this area have one of the highest rates. And I was curious to know if that is still true or not. Is it going down? Or do you have that answer?
So the Harlem really was the epicenter of the epidemic. It had the highest rates. The rates were equal to the high rates that we see in sub-Saharan Africa. Those rates, unfortunately, have decreased over time, and Harlem does remain one of the highest rates. It's number 2, though. It's no longer number 1.
Okay, it's great to hear.
But still extremely high. Still higher than most of the areas of New York City.
True, and going out to our listening audience, I know at one point we saw speak on, we were number 1, but I'm happy to hear that we're number 2. But still, at the end of the day, please make sure you take this information and pass it on. As we say, don't be stingy. Just for the next hour, I want you to make sure you, what's the word? Intake it, absorb it.
Absorb it,
all of that,
digest it, and then regurgitate it to everybody. No, I'm joking. Okay, but when we look at and just to use the Ebola virus again, right? We talk about these hemorrhagic fever syndromes, these really scary. I mean, you talk about horror, right? A person bleeding out of every orifice in the late stages of a disease like that, it paints a very vivid and horrible picture in people's minds, to the point where they were terrified. This gentleman, Dr. Spencer, he rode the subway and touched a few handrails, and people were terrified, just thinking about that. But when we look at HIV now, I mean, in the initial stages,
actually, it was like that. I believe that when the disease first came out in the 80s, whatever, it was people were the same exact way, if I recall. Because I was in high school around that time, and I remember it was like, "Don't touch me," you know what I'm saying? You might have AIDS, or you might have HIV.
But today, with antiretroviral medications and as you said, very potent medications, work very well when used correctly. We don't see the HIV epidemic the way it was back in the early 80s. People that are very gaunt and emaciated, that's not the image that we see anymore. And I think to a certain extent, some awareness about the transmission modes, certain little key details are being lost nowadays, and that's why we have these.
You're right.
That's why the rates aren't going down necessarily. So how can we, not to really scare people, but better inform them about this disease, and so that we can get better control?
What's the difference between HIV and AIDS? Because I think that some individuals still are baffled to the difference between what is HIV and what is AIDS, because they are different, and I think sometimes people use them in the same contents.
Right. So HIV is an acronym. H stands for human, I is immune deficiency, and V is virus. So it's kind of self-explanatory. It's a virus that causes deficiency in the immune system of humans. This virus is transmitted by blood and body fluids, so blood transfusions, sexual contact, and mother-to-child transmissions, and injection drug users can pass it on that way via blood as well. That is how you get HIV. The virus, once you get the virus, it takes 2-3 days to take hold, and then you are infected. Like many viruses, like the flu virus, about half of the people, maybe 75% of people, once they are infected, 2-3 weeks later, they may feel like they have the flu. You have fever, you have a sore throat, you have a rash, tummy ache, and then that gets better in 7 to 10 days, and then you feel better. And that was actually acute HIV syndrome. If nothing is done, your body tries to control the virus and can do so fairly well for about 7 to 10 years. And you feel pretty well, you look pretty well, but you have virus in your blood, and you can transmit the virus via those mechanisms.
And it's multiplying also, too.
It's multiplying, right? 7 to 10 years later, your immune system starts weakening. It can no longer control the virus. The cell in the body that the virus attacks is called the T cell, or CD4 cell. We all have them. We all need T cells to help us fight everyday infection. We need about 500 of them. Once you become infected, that number slowly starts to go down over those.
When you say 500, you mean like 500? 500
cells per drop of blood.
Okay.
So we have millions of T cells in there, but we measure it per drop of blood.
Okay,
and so over that 7 to 10 years, that starts going down. Once that number goes below 200, that puts you at risk for getting a very serious infection. Infections that we call opportunistic infections. So infections that are caused by germs that we normally live with, but don't cause problems for us because we have the immune system to protect us from them. But once your immune system weakens, the germs that live with us usually happily take the opportunity to make us sick because our T cells are low. So once your T cells go below 200, that is called AIDS, because you are at risk for getting this serious infection. And if you do get one of these opportunistic infections, that's also called AIDS.
So, and I'm curious to know if, and I'm trying to, because I'm going back to the days way back when I took infectious disease class, and they were saying that if you compare, if I recall, a blood cell to the HIV virus, so let's just say the blood cell is a basketball, and then if you take a penny and put that penny on top of the blood cell, that's a comparison of size to a blood cell to a HIV virus.
Exactly.
Okay,
and maybe
Nice.
even smaller.
I like that.
Probably much smaller than the penny. But
Yeah. I mean, trying to throw that analogy out there.
No, that's awesome.
A cell
I like that.
versus of the virus itself.
And that virus needs that cell. It goes inside that basketball, if you want to use that analogy. And in order to make more of itself, it needs that cell to survive.
Yes.
So it makes more of itself, and it comes outside the other side of the basketball and goes on to infect more basketballs. And so viruses need human cells to live. So that's if HIV, a person with HIV, blood is on the table, the virus dies. It does not survive without the human,
So
without the T cells.
just to engage you guys also and bring you into the conversation as well. As a health educator, Ms. Floyd, so what do you think are the areas where maybe people aren't getting the right information in terms of protecting themselves, guarding their HIV status, especially if negative?
Okay, so we'll talk about the negatives. If you're HIV negative, let's say, hopefully we would hope that you have tested, and that once you test, that you need to go back and retest. So we don't go on one test. We want to make sure that you go back and retest, and we also want to make sure that you start, doing some lifestyle changes. We want you to start wearing condoms. We want you to start educating yourself around HIV and AIDS, and also educate your partner. So now, if you're HIV positive, we would hope that you partner with your doctor, start on treatment, education. Again, they kind of pair together. So education is the key.
I think we got like 1 minute left, because the question I have for you, and I know people in the listening audience probably want to hear this, is the myths and misconceptions. What are some of the myths that are out there about HIV and AIDS, and what is the facts?
Oh boy, that's like a whole segment.
One of the biggest misconceptions is that if you stand next to someone or if you're near someone, that you can get it. Just by being in close to someone, I'm gonna get it. No, HIV is transmitted through blood or bodily fluids. So that's one of the biggest. Of course, also it's the other one. It's that it's a cure for HIV and AIDS. It's not. We don't have a cure yet. We have a lot of good medicines, which we know how to treat it now. We know how to teach you how to prevent it, but no cure. Those two things. It is so many misconceptions.
I understand.
True
Some of those
story.
misconceptions are the reasons why the numbers are high and the behaviors, can't change because of the misconceptions.
Gotcha.
You said something about a fact.
I would add that one of the bodily fluids that does not transmit HIV is saliva. We hear this a lot, kissing,
Oh, so saliva
drinking.
doesn't transmit.
No.
No.
Because when you hear fluid, you think saliva,
All body
blood,
fluid,
semen. Okay, saliva doesn't.
Yeah.
All right.
So no sweat, no tears, no saliva.
Oh, that's so sweat, saliva, and tears does
Tears.
not
Do not.
transmit, because I thought they did.
No.
So there are studies that show that HIV virus may be in those body fluids, but there's never been a case that's been transmitted in that way.
Thank you. So let's learn something.
All right, ladies and gentlemen, you're listening to Health in Harlem on WHCR 90.3 FM New York. We're going to take our first break for the evening, but you can call us at 212-650-6903 if you have any questions, comments, or concerns about tonight's show. That is 212-650-6903. We will be right back. Stay with us.
WHCR 90.3 FM, New York.
Backed by popular demand, after sold-out performances last season, the world-famous Apollo Theater presents an all-new staging of Ellington at Christmas Nutcracker Suite, featuring Broadway stars Norm Lewis and Priscilla Baskerville, with performances by Liz Wright, Jason Samuel Smith, students from the Dance Theater of Harlem, and more. Musical direction by David Berger. Performances are December 13th and December 14th for 3 performances only. You heard me, 3 performances only. Tickets are available at Ticketmaster.com or visit www.apollotheater.org for more information. The Harlem Hospital Center Department of Food and Nutrition Services hosts its annual food drive on Monday, November the 10th through December the 24th. You can donate unexpired, non-perishable food products to any food bank receptacle located throughout Harlem Hospital. All food collected will be donated to Harlem Mothers Save. This is your opportunity to help provide food for families in need during the holiday season. Harlem Hospital is located at 506 Lenox Avenue at 135th Street. For more information, call Sean Shivers at 212-939-1936.
WHCR 90.3 FM, New York.
War and destruction continue to escalate. A worldwide epidemic of ignorance and hate has infected people of all faiths and colors, poisoned them against their sisters and brothers, yes.
Welcome back to Health in Harlem, ladies and gentlemen. My name is Maurice Selby.
And this is Sean Shivers.
And tonight we have 3 wonderful guests with us. We have Dr. Lisa Gay Robinson, MD, MPH. She is the medical director of the Pediatric and Adolescent HIV Clinic at Harlem Hospital and has been caring for HIV-infected children and young adults for over 14 years. So thank you very much for that. Applaud that for sure. We need an applause button, man, on this thing. Yeah, there we go. All right, we have Miss Julia Floyd. She is a health educator working with the Harlem Hospital HIV population for more than 20 years. Oh my goodness, we need like a band, like drums. Okay, and we have Dr. Pamela Guthrie. She is a PhD in psychology, director of the Harlem Hospital HIV mental health program, and she has been working with HIV-infected clients for 3 years at Harlem Hospital. And yeah, we need like a whole like bandstand, man, for you guys, because this is really important work, and we're glad that we're getting this information out there to let people know that you are here in Harlem and that they have these services and resources at their disposal.
But you know what, Mo?
You gotta take advantage.
That's like all our shows. If you realize, on all our shows, we have a department head, someone who's an expert in it or has been in the field for like 20 years, almost every show that we have. That's what I love about this.
True story. So we talked about and touched upon the importance of testing, and Ms. Floyd, you made an excellent point in that one individual test, although is very important and it tells us a lot of information, and we can get people where they need to be in terms of follow-up care, whether or not they had a positive or negative result. It is not about one test. One test is not the end all of the conversation. So tell us about the importance of retesting and what these results mean, whether or not you're positive or negative, and what happens after that.
Okay, so a negative test results means that, you know, your body is not showing any evidence of being infected at that time, but it takes the body 3 to 6 months to develop antibodies, you know, to show that you may have been exposed or you may be infected with HIV. We encourage people to come back in 3 months, and we also encourage them to use protection during that time during those 3 months, because, you know, you can go out and be exposed at that time. So we just really encourage lifestyle changes during that time. So one test, no, it's not enough. It's not telling us. We need to make sure. So you retest at 3 months. Even if you become positive, we will retest you, and then other bloods will be done. Viral load and T cells will be done also when you become positive or when you test positive.
So if you, and I don't know if you answer this or not, but if you are negative for the virus, so how often thereafter should you just get yourself tested to make sure that you're safe, would you say?
I guess if you're in high-risk behavior, meaning you're having a lot of different partners, you're not protecting yourself, then you need to get tested more often. But ideally, we would prefer that you make some lifestyle changes. It should be a part of your routine checkup, your annual checkup.
Yeah.
You know.
Oh, okay.
I mean.
And I think that's what the New York State Department of Health and the New York City Department of Health and Mental Hygiene are pushing for, is that this should be a regular thing on any visit to any healthcare institution or any health examination that's being done. This should be, or you should at least be offered. As a patient, you have a right to refuse testing, but it should be offered to you.
And you know, so funny, and I could be wrong, but I believe that Dr. Adamson, he's the director of ambulatory care, medical director of ambulatory care, and also Denise Soares, he is the executive director of Harlem Hospital Center. I could be wrong, but I believe that they said that's the process now for patients that come into AmCare, that they automatically, I don't know, offer them or just say, do you want an HIV test? Is that true?
Absolutely.
Okay.
In 2010, it was a recommendation from the CDC that all persons in the United States between the ages of 13 and 64 get offered an HIV test whenever they walk into a medical facility or going for a medical visit. So that at Harlem Hospital, and New York State has also have regulations now that is an expectation. Harlem Hospital and the Health and Hospitals Corporation, that is something that is also being pushed. So it's part of our electronic medical record. There's an expectation that at least once a year, there should be evidence in that patient's chart that patient was offered an HIV test. As you said, you can refuse the HIV test, but we must document that we have offered the test and given counseling on why we think this testing is important and continue to do so. But the patient, of course, has the right to refuse.
Gotcha.
Yeah.
Now,
and you might, if you come to the emergency room for a broken leg,
That's right.
You even get offered it there.
You get
So
it
that's not
offered
why you walked in.
Every
But
day.
there's-
People
So-
come in like, oh.
And I know y'all
HIV
kind of
test.
touched upon this throughout since we started the segment. But what are the signs and symptoms? You know, at what what are the signs and symptoms? At what point would an individual, besides getting it checked annually, what are the signs and symptoms that a person should say, you know what, I think I might have something. I need to really, really, really go get myself checked.
Yeah. So again, as I'd mentioned before, there is the entity called acute HIV. So when you are first infected and your body sees this germ, it has a reaction, and it's a flu-like illness that happens a couple of weeks after you're infected, which lasts about 7 to 10 days, and then you get over this flu that you think you might have had. And then you feel pretty well, most people, for as long as 7 to 10 years. And so if you don't get tested during that 7 to 10 years, you are infected and you don't know. At the end of that 7 to 10 years is when your body, your immune system starts weakening, and that's when you do lose weight. That's when you start getting a pneumonia that it might get better after you're treated, but then you get another pneumonia, or you start having diarrhea that won't get better. And so those are the types of symptoms. You might get rashes on your skin, or lesions on your skin that are unusual that won't go away. And that was the face of AIDS that you talked about from 25, 30 years ago. That was a very scary face of AIDS. And we don't see that as much these days. And that's a wonderful thing. How we prevent that, and that's why this recommendation for testing. Because we know that the sooner we identify somebody and the sooner they get linked to care and start going to care and start taking medicines, that they can live a long, healthy life. And the sooner you find out and get on treatment, the better your immune system will be and the longer that you will live.
And I'm glad you're saying that, because from my experience dealing with individuals at the hospital, in the community, is just that when they hear that they're positive, and this is especially like a couple of years ago, when they hear that they're positive, they think it's a death sentence. It's like, I'm HIV positive, and it's just like all hopes of life is just gone. And what can you say to just reinsure? Actually, you said a lot already to reinsure that it's not a death sentence, to people in the community. But I think that's still out there.
Yeah. Oh, it is absolutely out there. And HIV really ravaged the Harlem community. And I think when many people think of HIV, they still think back to the persons that you talked about in the beginning. And it is very frightening. And it absolutely does not need to be a death sentence anymore. If you don't take your medicines, if you don't go and stay in care, then yes, you can get quite sick and you will die. Correct. Absolutely. However, it is very important that we, there's a blinking light.
Yeah. That's the caller.
Okay.
Okay. As far as the face of Harlem a couple of years ago.
Right. So one of the examples when I telling a new patient that they are infected, to reassure them, it's very hard. That's a difficult time when somebody's getting a diagnosis. But I talk about patients who I've been caring for who have had this virus for 25 years. I'm from the pediatric adolescent clinic, so most of the patients I have been caring for were born with HIV. Some of them are in their early 30s. They've had it for 30-something years.
Wow.
And they have gone to college. They have children. They have children who are HIV negative. They have partners who are HIV negative. They have a career, and they're living a quote-unquote normal life. They have HIV, and they have to come to the doctor more often, and they take medicines every day, but they are living a normal life.
Great to hear.
Okay, ladies and gentlemen, we are going to take another break. You're listening to Health in Harlem on WHCR, 90.3 FM New York. Remember, you can call us at 212-650-6903. That is 212-650-6903. We will be right back after this break, ladies and gentlemen. And remember, also, you can hit us up on Facebook. Just type in Health in Harlem into the search box on your Facebook page, and Sean and I will pop right up. You can
two handsome
gentlemen, and you can leave your comments, questions, or concerns right there, and we'll try our best to answer them. We'll be right back. Stay with us.
WHCR 90.3 FM, New York.
If you know the symptoms and get the facts, you'll know the signs of a heart attack. Women, listen to me, and when I'm done, if it sounds familiar, call 911.
Pain in your neck, chest,
arms or jaw,
shortness of breath,
please tell us more. Cold sweats and nausea, tiredness,
it's time to take it
serious. Back pain, stomach pain, shortness of breath, cold sweats, nausea, dizziness. If you know the symptoms and heed the signs, you'll be around for a long, long time. Women, listen to me, and when I'm done, if any sound familiar, call 911.
Learn a song that could save your life. Get a free download at womenshealth.gov/heart attack.
Women, listen to me, and when I'm done, if any sound familiar, call 911. If any sound familiar, call 911.
A message from the U.S. Department of Health and Human Services.
911.
Hi, I'm Vinny B of the Vinny B Showcase. Tune in every Thursday from 8 to 12 midnight for some solid cultural roots music and some sweet lovers rock. Also, informative interviews and giveaways. Right here on the Vinny B Showcase every Thursday, 8 through 12 midnight on WHCR 90.3 FM. Peace.
Said
WHCR 90.3 FM, New York.
Broken homes and families struggle to survive. Children of abuse fight to stay alive. Shattered relationships.
Welcome back to the one and only Health in Harlem. I am Maurice Selby.
And this is Sean Shivers.
And tonight, ladies and gentlemen, we are talking about HIV in New York, past successes, current challenges, and future goals. And we have in the house tonight here at WHCR Dr. Lisa Gay Robinson. She is the medical director of the Pediatric Adolescent HIV Clinic at Harlem Hospital. Julia Floyd, Miss Julia Floyd, she is a health educator working with the Harlem Hospital HIV population for over 20 years. And we have Dr. Pamela Guthrie. She is a PhD in psychology and the director of the Harlem Hospital HIV Mental Health Program. And before we get back to our conversation, Sean, you have an announcement
yes,
to
I have
make.
a quick announcement to everybody. Just to let everybody know, it's the holiday season right now, and unfortunately, I get kind of upset about this. There are still people in this community who do not know where to go to eat, don't have enough food for their family. So once again, Harlem Hospital Centers, we're having our annual food drive. So between now and December 24th, we are going to be collecting canned goods. So if you have any type of non-perishable items, canned goods, flour, things that don't spoil, rather anything in a can, please bring it to the hospital.
Yams.
Yams. True. We have receptacles set up in all buildings of Harlem Hospital. We have it in the MLK lobby. We have it in our new Mirror Pavilion lobby and our WP lobby, that's Williams Pavilion lobby, Ron Brown building, the Kuntz building. So any of the major buildings at Harlem Hospital Center, we have a food box, and you just put all your canned goods in there. If you do have canned goods that you are unable to bring to the hospital, you can always give me a call. My number is Sean Shivers, 212-939-1936, and we will make arrangements to come pick them up. So between now and December 24th, we're going to be collecting canned goods, and all proceeds and all food is going to be donated to Harlem Mothers Save Another Violent End. And this organization is located on 306 West 128th Street. And outside of trying to keep guns off the street, they're also putting food in the mouth of people in the Harlem community. And so all proceeds and all food is going to go to them. So again,
That's what's up.
212-939-1936. Give me a call if you want us to come pick up food. But please drop your canned goods off at the hospital.
All right. And then get your HIV test.
Yes.
At the same
Very
time.
much.
All right. Now, back to our conversation. So, one major thing that's become really, really big in the last decade is the impact of mental health on all of this. The HIV epidemic, people going in, getting care, and following up with care, whether or not they had a positive or negative result, because you still have to get the proper care afterwards. What would you say, Dr. Guthrie, is the how would you phrase the mental impact on all of this epidemic on people's mental states, and how mental states affect people in their care, the care that they receive?
Well, the impact is huge, absolutely. People who are HIV positive have higher rates of mental illness. About 50% meet the criteria for some type of diagnosis. Primarily depression, anxiety, substance abuse, and post-traumatic stress disorder. There's very high rates of trauma among people who are HIV positive. So it's hard to say, it's kind of a chicken and the egg question as to whether the HIV diagnosis preceded mental illness or vice versa. We can't really say. But we do know that mental illness has a huge impact on HIV care, which is the reason why we have a program like ours where you have a mental health provider on an HIV program. So basically, people who are mentally ill have poorer rates of medication adherence. They're less likely to take their medication. They have poorer health outcomes, particularly with depression and post-traumatic stress disorder. In those situations, they have lower T-cell counts, so their CD4 counts can be lower, and the illness can progress faster. We also see that with heart disease and other things where depression has a very negative impact on health. They're also more likely to miss medical appointments. There's issues of communication with your medical provider, particularly for people who are more severely mentally ill. They may have a hard time. The provider may not always recognize symptoms. And if they do, they may not know how to best communicate with that patient. So it's definitely significant, for sure.
I'm just curious to know that would you say that the reason why individuals don't want anyone to know that they are HIV positive or have the virus is because of the stereotype that everyone, if you are HIV positive, that means that you're homosexual or something like that? Would you say that's one of the main reasons? I'm just curious to know.
I think stigma is the primary reason why people don't disclose their status, and why it's such a difficult illness for some people to live with, for sure. There's stigma around transmission, like you mentioned, whether or not you are gay, whether or not you are promiscuous and have a lot of sex, whether you're a drug user. People tend to have a lot of stereotypes about people who are HIV positive.
Yes.
They don't realize that most people are actually infected within a relationship, that your partner is the most likely person to infect you. So people don't actually think about that.
Wow.
And so stigma, I think, is another reason why people don't get tested. They don't want to know. They don't want to then have to kind of manage this and tell people and things along those lines.
I was reading somewhere, I don't know if it's true or not, you can correct me if I'm wrong, is that African American women are the group that have the highest in as far as HIV. Is that true?
In terms of
having a disease, African American women in the U.S. I mean, I could be wrong. I'm just something I read somewhere.
And that was data a few years back. They've never been the highest.
Okay,
I think in terms of the rates of infection,
Yes.
of new diagnoses, young African American men who have sex with men, and also young black women, those two groups had the highest rates. Those were actually increasing while everybody else was kind of leveling off. Now the highest rates are still in African American men, and mostly those who are young MSM. The age group is between 20 and 29 that have the highest rates.
The question now comes down to why would you say the reason why, and it's an opinion again, is that is it because of lack of education, or just don't want to know? I mean, I don't know. I'm just getting your opinion.
Lack of education
regarding knowing what the virus is, or I mean, because African American, other cultures, it's stagnant or going down, but we still see African American within a certain age still rising, and all the stuff that's out there and all the literature that's out there. Why is that still the case?
Right. So I think the rates are high in African American communities. It also is in areas where there is high poverty, which Central Harlem is one of the highest poverty rates in New York City. In areas where there's high poverty, there are issues with education, health literacy, mental illness, and homelessness, food insecurity.
Healthcare, yes.
Right.
Okay. It all makes sense.
No
access.
Good health insurance, access to good health care. And all of these are contributing factors. And if you are not sure where you're going to get your next meal or where you're going to sleep tonight, getting an HIV test or making sure that you have a condom when you have sex is not a priority.
Correct.
So there are many there are many things that have to be tackled here. And so education is absolutely one of them. But I think the root cause of the increased rates is poverty. And tackling that, as we know, is a bear.
I think women also have different issues to face. For women, condom negotiation is not always easy. Studies have shown that women who are HIV positive have twice the rate of domestic violence as a general population. It's not easy to negotiate wearing a condom with your partner if you're afraid how he's going to react. So that I think, trauma, they also have very high rates of sexual abuse histories. So I think these are other factors that come into play with sexual behavior, substance use. If you're using any substances, you're less likely to protect yourself. So those are other factors that I think we don't talk about
But
enough.
as you think about it, it makes sense, though.
So knowing all of these things that we just talked about, all of the factors that lead into the increased rate, especially amongst African Americans, and specifically here in Central Harlem, how do you guys then, when we have an individual that shows up, right? They did the right thing. They showed up to the clinic, and they consent to get the test, and that result comes back positive. Then what is the next step? And especially considering all of the things that we just talked about, the barriers to care, right? So the lack of access to care. They might not be the most educated, might not have the financial means to then follow up and get these expensive medications. And then let's not even talk about, but even considering the mental aspect, right? Dealing with depression. One of the major symptoms of depression is lack of interest. You don't care. You don't care about anything about your health. You don't have the energy to care. So to take these medications, I can tell you, I had a needle stick. I had to take prophylactic antiretroviral medications. It's difficult. It's difficult to do, to remember to take that. And so imagine being not even interested in taking that.
Take
so
a pump,
all these
and
things,
same thing. It's like,
how do you then, with this positive result, what is the next step, and how do we bring all of this stuff together to make sure that this individual gets the care that they need?
That was like 10 questions in one.
I know. Go ahead. It's difficult, but that'll carry us through the rest of the show pretty much.
Okay, so the short answer is a really dedicated, experienced, multidisciplinary team. It's not one person that can do this. It's not one provider. I think what we've learned over the years is that HIV affects many aspects of your life. It's not just a medical problem. For children who are in school, it can affect school. Medicines can affect sleep. You're concerned about it, people finding out. When they're adolescents or adults, it affects your desire to find a partner. You have the stress of disclosing to a partner. To tackle all of that, a physician can't do that alone. This is why I didn't come here alone. I came with my health educator and
awesome.
our team and our psychologist. We have, in addition, case managers, and this is everybody. This is from you walk in the door, the clerks at the front desk. There has to be a compassion and empathy and understanding for patients with HIV. They have a secret that they don't want to share, and the space that they come into when they walk into that clinic has to be a safe space. So everybody has to be involved in their care and show that they're holding their secrets and that they're being treated with respect and dignity. So it's a team effort. We've also, over the years, recognized the importance of using peers, persons who are infected with HIV, who are willing to disclose publicly, at least within the clinic, and work with new patients, so that it's just not me or another provider or someone, a staff telling you it's going to be okay. You have someone who has this, who's telling you it's going to be okay, and here's how I did things, and work with us.
You have so much passion in your voice. If I was someone listening right now, I would definitely want to come to Harlem Hospital Center, to the clinic, and speak to you, because you have so much passion. And it's like a trust. Like, I want to come and talk to you because I feel that my secret, as you said, can be kept. I thank you.
And then we're going to take a break, actually, and then we'll come back and we'll finish up with the last segment. Ladies and gentlemen, you're listening to Health in Harlem on WHCR 90.3 FM New York. This is your last chance to call in with any questions, comments, or concerns. We would love to hear your questions. And also address any myths out there. If you got a question, you think you heard something on the street or you read it online and you want to get verification, you can call in tonight and get some free expert information. Okay? We'll be right back. Stay with us.
WHCR 90.3 FM, New York.
Backed by popular demand,
After sold-out performances last season, the world-famous Apollo Theater presents an all-new staging of Ellington at Christmas Nutcracker Suite, featuring Broadway stars Norm Lewis and Priscilla Baskerville, with performances by Liz Wright, Jason Samuel Smith, students from the Dance Theater of Harlem, and more. Musical direction by David Berger. Performances are December 13th and December 14th for 3 performances only. You heard me, 3 performances only. Tickets are available at Ticketmaster.com or visit www.apollotheater.org for more information. The Harlem Hospital Center Department of Food and Nutrition Services hosts its annual food drive on Monday, November the 10th through December the 24th. You can donate unexpired, non-perishable food products to any food bank receptacle located throughout Harlem Hospital. All food collected will be donated to Harlem Mothers Save. This is your opportunity to help provide food for families in need during the holiday season. Harlem Hospital is located at 506 Lenox Avenue at 135th Street. For more information, call Sean Shivers at 212-939-1936.
Nurse, set up an IV. And you, her boyfriend, you were the driver?
Yes, doctor, but I didn't mean to hurt her. I only had a few drinks. I was just buzzed.
Just buzzed? Oh, then your girlfriend is fine.
Hey, sweetie. I feel great.
She's really okay?
What, are you kidding? No, not really. Nurse, get me a suture kit. Stat.
Buzzed driving. Maybe we should stop acting like it's no big deal. Buzzed driving is drunk driving. Brought to you by the U.S. Department of Transportation and the Ad Council.
WHCR 90.3 FM, New York.
Welcome back to Health in Harlem, ladies and gentlemen. I am Maurice Selby.
And this is Sean Shivers.
And tonight we are talking about HIV in New York City, past successes, current challenges, and future goals. And we actually have a caller on the line. Caller, are you there?
Jay Smiley.
Brother Jay Smiley from Harlem, correct?
Yeah, from Harlem.
Awesome.
I appreciate the free medical advice, first of all. Happy season.
Thank you.
Holidays to all that are there.
Happy holidays.
Thank you. I want to throw a monkey wrench out there. I know years ago, and I'm not going to try and really label it years ago, but at a time going by, there was some question about a false positive or a false negative. I wondered, would you speak to that, or is that still something that
it's an excellent
looming
question.
in the investigation of HIV?
So when you say false positive, so a person who goes for an HIV test and gets a test that's positive, but in reality it's not really positive, it's negative? Is that what you're asking?
Yes, I know that was the query, years going by. It was a question that people were coming back and saying that, oh, yeah, I had a false positive or a false negative.
Right.
Something to that degree.
Exactly. So that is a fact. All tests are not perfect, and some tests you can get a positive test when it's really negative, and vice versa. There we have the Aura Quick test, which kind of a name that suggests it's from oral fluids, and the initial test was. And that testing did have a significant number of false positives. It was still low 90%, a very good test, but up to 5-7% of positive tests really were not positive. So we've moved away from actually using that test, and the test that we're using now is a blood test, and that test can still have false positives. I had one just 2 weeks ago in a young man, but that is now very rare with the tests that we use. As science improves, the sensitivity and specificity of testing improves as well. So there still are false positives, but they're rare these days.
And you had mentioned earlier in the show that you cannot get HIV through the transmission of saliva, tears, or sweat. And then I'm thinking, why would you have a test where you swab the inside of your mouth if so that's the reason why they don't use it anymore?
No.
Okay, all right, sorry.
It's a little bit different.
Okay,
a
got
little
it.
bit more complicated than that.
Okay.
So did we answer your question, Brother Smiley?
Yes, and just to say, I did mention that it was years going by.
Yeah.
That particular quarry was one of the things that most people were trying to balance. But the other thing is, also years going by, there was a statement, not necessarily from the medical community, but that was going around that you should not get tested too regularly because it throws up a red flag in your medical record. So I don't know how true that is, or even was at the time, but that's my history.
Yeah, so I think now the push is to get tested. Certainly every year, and if you have participate in high-risk behavior every 3 months, that's the red flag would be that you're taking care of yourself.
Correct. I think that's the important thing, Brother Smiley, is that one, this is why they're trying to sort of routinize this process, right? This should be part of a routine medical screening for everybody. So there's no stigma. You go in, right? This is a health maintenance exam test, essentially, where you're going in and just making sure that everything is fine. And if there is a problem, then guess what? Now we know, and it can be treated. You can get the appropriate care following that. So that's one of the purposes of doing this for everybody and offering this test to everybody, is that there's no stigma. This is part of your health maintenance and essential to your well-being in the future.
Yes, sir. And that is one of the things that they do offer. I know each time that I've gone for regular medical, they do offer.
Got it.
And you do have the right to refuse without consequence.
Absolutely.
Right, thank you.
Thank you very much for
calling, as always.
Pleasant evening to all.
Happy holidays.
Thank you.
All right.
And I see that we our time is short, and hopefully Vinny B will give us like 2 minutes of his time when he comes in. But Project Hope, and as I was saying during the commercial, that I didn't hear about that program. I haven't heard about that program, and I'm going to hear about it now. So what's that program all about?
Right. So at Harlem Hospital, we have a large HIV clinic. We take care of 1,000 approximately patients. That includes children, adolescents, and adults with HIV. There are various programs that take care of those separate patients. The HOPE program is a program, an acronym. The H stands for Harlem. O is owned. P is program, and E is for emerging adults. So Harlem's own program for emerging adults. It's a program in our adolescents HIV clinic. And one of the challenges that we've faced with patients who've had HIV since birth is that once they become young adults, we can no longer see them. They have to be transitioned into the adult clinic. And the so-called coddling that pediatricians do with their patients, kind of taking care of them as children, we continue to do through adolescence. And then once they're 21, on to the adult clinic. But they have to know how to make sure they have insurance. They have to know how to call and make their appointments, keep their appointments, come on time. If you don't come on time, there are consequences for that. So this program is to help develop their self-management skills.
Awesome.
So that they can transition truly to the adult clinic and emerge as really full functioning
adults.
yes.
I like that.
And be able to take on their health care.
So quick question. Damn, I see what time it is. The quick question I have for you is that we talked about the medications of, as far as some of the treatments, but outside of the medications, what changes in one's lifestyle would you have to do if you are positive with HIV? Are there some, because I'm going to assume that there are some things, the way you live your life, there's some changes that you're going to have to do. And what are those changes?
Well, certainly taking your medications. That's like to routinize that in your life. Just as you don't leave the house, I hope, without brushing your teeth or washing your face, you have to figure out how in your life you are going to incorporate taking medications in your life. In terms of relationships with your sexual partner, that is something that also has to be addressed. There is first disclosure to this partner, which is something that our mental health team helps us and helps the patients to deal with and to get that very difficult thing done. And then negotiating condom use. Making sure that taking your medicines, if you take your medicines and you have your virus under control, you are very unlikely to pass the virus on to your partner. So taking your medicines is not only for you, it's also for your sexual partner. So I think it's really the incorporating medicines in your life and also making sure that your partners are and you are safe. Anything else you'd like to add?
I would also say that you come in more regularly for medical appointments just to kind of keep an eye on things, make sure that your T-cell counts are climbing, things like that. There's more blood work, just little things like that.
I was just going to ask about the negatives, because I think we focus on the positives so much, but even the individuals that are negative, and especially if they have risk factors, men who have sex with men, people that are IV drug abusers, these individuals, or a person that is in a relationship with an HIV positive individual. How do we make sure that we guard their health status, their negative status? What can be done to assist those individuals?
So education, absolutely education. And I think I know that we're short on time, but in June 2014, Governor Cuomo announced the desire to end AIDS in New York State in 2020. So that's ending AIDS, not HIV. So AIDS, meaning no one should progress to the point where they might get a serious illness and die from that illness. So to control HIV. And we're going to do that in 3 ways. The first is making sure everyone gets tested and knows their status. So if you're infected, you can get into care, stay in care, and take care of yourself. If you're negative, you ensure that you stay negative. And for those who are in a relationship with a positive partner or who have high-risk behavior, PrEP is something that is really being touted as extremely important and is going to help us achieve eliminating AIDS. So PrEP is another acronym. We like to create acronyms in medicine.
True story.
True story. So this is pre-exposure prophylaxis. So before you are infected, you are going to take medicine to prophylax, so to protect you from getting HIV. Studies have been done with various populations, heterosexuals and men who have sex with men, in discordant couples. So a partner that's positive, a partner that's negative. They've looked at studies putting the partner who is negative on HIV medicines, and then testing to see if that decreases their risk of getting HIV. This does not mean you don't use a condom. All of the studies always recommended using condoms. And it showed that taking this medicine, it's one pill that has 2 medicines in it, decreased the risk of transmission of HIV.
I call that deep love.
All right, 1 second.
Oh, yeah.
WHCR 90.3 FM, New York.
Good evening, doctors. I'm Vinny B. I'm on next, but you have all the time, okay? Because this is very important what you're doing here. I'm a little ignorant here on what you just said a while ago. So you're telling me, if my partner is HIV affected. We can still mingle, and I don't catch it by taking a pill. I don't get the disease by just taking a pill.
That's correct. But this is taking. I mean, the it's not you taking a pill only. We want your partner to take their pills so that their virus is controlled.
Yes.
We do want you, when you mingle, to do it in a protected way using condoms. But in addition, if you take medicines yourself, the person who does not have HIV takes medicines daily. So this is not like a plan B with pregnancy, where you and then you take a pill. This is something you're taking every day. This is the assumption is people have sexual activity several times a week. So it's not, I'm going to have sex tonight, let me take a pill and then we can have sex. It would be something that you're taking every day, just like your infected partner is taking every day.
In your experience, there are a lot of couples out there today who, because I call, and this is my opinion, deep love. You know, my partner is HIV positive. You know, I really love them, whatever. So now I'm going to take a pill, and I just see another emotion coming on. I mean, does that happen a lot in the community, or in general, that someone is actually negative taking a pill because their partner is positive?
So the push for this has just begun. Okay. So I think we don't have that data yet.
All right.
I think this is new, and this is something also that is offered at the clinic.
We need to expand to 2 hours. All right, ladies and gentlemen, this is Health in Harlem. We are wrapping up.
But actually, you know what's so funny is that this is not the first time.
True.
This is not the first time that we had this. This is not the first time we had this topic on here. You're like
true story.
It's like the fourth time, but your conversation is the most interesting.
Ooh. Ooh.
No,
all right.
No.
I know.
I love my girl.
This is a very
Miss Austin. Vanessa Austin, that's my girl. I'm just saying is that, you know, it's just very
we definitely tackled it. We attacked it from a different
perspective.
That's
my girl. I would
that's
put it out
colleague. That's our colleague.
I know. That's my girl. You know,
we attacked it from a different perspective. And but what Sean said earlier was the passion that you guys emanate is really important, I think, and I think our listening audience can appreciate that, and hopefully we can get people to come in and talk to you guys. And if you could just give us a number to the clinic so that people can go in to get more information, to inquire about testing, that would be great.
Sure. The number for testing is 212-939-1054, and the number directly to the clinic is 212-939-2910. All righty.
And we all want to thank you all for joining us tonight.
Very much. I've learned a lot.
Very insightful conversation, and we welcome you back to Health in Harlem and WHCR to engage in more talks, and also to get more information out to our community. We also want to thank Sean Shivers, and we want to thank Vinny B for giving us a few extra minutes, because he is the man.
But everybody, please make sure you tune in next week. We have another great topic. Do you have trouble? Let's say you're trying to stop smoking and you don't know how to. Make sure you tune in next week. Our topic next week is how to win the war against tobacco and smoking triggers. And I'm going to have my girl, Miss Eugenia Graham from the smoking clinic at ambulatory care at Harlem Hospital Center. So our topic next week is about smoking.
Yes.
So please make sure you tune in for some more great information.
Yes, indeed. And we also want to thank Valerie Wright. She is the producer of Health in Harlem. We wouldn't have such wonderful guests if it weren't for her. So thank you very much, Valerie. And ladies and gentlemen, this is Health in Harlem signing out. This show is dedicated to the memory of Miss Gloria Thomas. Harlem, take care of yourself.
WHCR 90.3 FM, New York.
Oh, wisdom, you got to have it, yeah. Oh, wisdom, yeah. All right. Rise up and smile. Don't be shy. With love in your arms, you got to be conscious. You got to righteous. Can't you see the sign of the time we're living in? Got to use it every day. It's what we need today. Whoa. You got to use it every day. It's what we need today. Wisdom and knowledge will guide you through. Don't you be the devil too. No, you can't guide a people without a vision. You shall surely go astray. The Bible can teach you wisdom, whether you wife or you dumb. An elder can teach you wisdom, whether you're old or you're young. Oh, wisdom, oh, wisdom, oh, wisdom. Only a fool trust in his own eye. To be humble, free from anger, and your days shall be low. You gotta use every day. It's what we need today. You gotta use it, yeah. What we need today. Whoa. Oh, wisdom. Whoa. All right now. Oh, wisdom. Hey.
Fellow citizens of Africa, I greet you in the name of the Universal Negro Improvement Association and African Communities League of the World. As you are aware, the world in which we live today is divided into separate race groups and distinct nationalities. Each race and each nationality is endeavoring to work out its own destiny to the exclusion of other races and other nationalities. We hear the cry of England for the Englishman, of France for the Frenchman, of Germany for the German, of Ireland for the Irish, of Palestine for the Jew, of Japan for the Japanese, of China for the Chinese. We of the Universal Negro Improvement Association are raising the cry of Africa for the Africans, those at home and those abroad. The great problem of the Negro for the last 500 years has been that of disunity. No one or no organization ever succeeded in uniting the Negro race.
What was done for 300 years, the bodies of men. You can shackle the hands of men, you can shackle the feet of men, you can imprison the bodies of men, but you cannot shackle or imprison the minds of men. Turn them down, turn them down. Words from Marcus Messiah Garvey. Words, sound and power. You know what we're thinking about? That is our own private business. Black men of Ethiopia, Timbuktu, Alexandria gave the light of civilization to this world. Ethiopia shall stretch forth her hands unto God, and princes shall come out of Egypt. Because classes, nations, races have been quite for over 4 centuries. Who was merely born of use, insult, humiliation, whose forbearance can only be compared to the prophet Job, as likewise lifted his bowed head and raised it up to God's skies and cried out, I am a man, and demand a man's chance and a man's treatment in this world. But I shall teach the black man to see beauty in his own kind and stop bleaching his skin and otherwise looking like what he's not.
African freedom, African freedom, chant them down, chant them down.
God made man Lord of his creation, gave him possession and ownership of the world. And you have been so darn lazy that you've allowed the other fellow to run away with the whole world, and now he's bluffing you and telling you that the world belongs to him and that you have no part in it. I don't have to apologize to anybody for being black, because God Almighty knew exactly what he was doing when he made me black. If black people knew their glorious past, then they would be more inclined to respect themselves. Yes, you heard of Johnny Walker Red and black. Well, he had his adversities, but he's still going strong. Well, I intend with your help and God's grace to continue, because my work has only just begun. And future generations shall have in their hands the guide by which they shall know the sins of the 20th century. I know, and I know you too believe in time, but we shall wait patiently for 200 years if need be to face our enemies through our posterity. When my enemies are satisfied, in life I shall come back, or in death even to serve you as I served before. In life I shall be the same, in death I shall be a terror to the